Hey, everybody, and welcome to All About Health and Wellness. My name is Dr. Usry. We are sponsored by All American Wellness, and we're brought to you by Podcast Junkies. That's podcastjunkies.com, Junkeez. Contact Ben Castro or Christian Perillo if you want to get your message out to the masses. These gentlemen are great to work with. They bring us onto Spotify, they bring us onto Apple, and they bring us onto YouTube. And this has been my joy to work with them because, frankly, they're easy to work with and they're very cooperative in helping me get my message across. So I had my subject all set up on what I was going to talk about. I was going to talk about the difference between ridiculopathy and peripheral neuropathy. Maybe you've heard of those two problems that affect people, or you haven't, but we're going to have to wait because as I walked in today, my producer extraordinaire, Ben Castro, shared with me that he had totaled his vehicle. And my next question, of course, to Ben was, well, how did that happen? And as he was giving me his rendition of the automobile trauma, I said, are you okay? And he said, I'm not really sure. I'm just kind of waiting to see what happens. And this is when I informed him about the law. The law in the state of Florida is you have 2 weeks after you've had an automobile trauma to get the auto insurance company that you pay every month to pay for your care as a result of automobile-related injuries. 2 weeks, that's it. And many times people have problems that they notice afterwards, certainly not right away, because when you have this kind of traumatic event, it sets your adrenaline and your cortisol that your body produces skyrocketing, and many times it can mask symptoms of injury. So if you're listening to anything, trying to get little tips and little gold nuggets about your health, if you're in an automobile trauma, go see a doctor right away. Who's ever more convenient to get into, if it's your chiropractor, if it's your local urgency center, it doesn't matter. Go see someone, have them look at your cervical spine in regards to an examination and an x-ray to see if you've lost that precious curve in your neck. That curve is so important, it can have an effect on whether you enjoy a lovely life the rest of your life or whether you're plagued with myofascial pain syndromes because what you didn't think was a big deal has turned into a major problem for your lifestyle. A simple x-ray will tell them the information that they need to see as to whether you have suffered an AOMSI injury. So by all means, this is what we see on a daily basis at All American Wellness, 561-863-8779, or any of your local healthcare practitioners that are close to you. Don't delay. Go see someone if you've had a car accident. Now, I think I've spent enough time on that. Hopefully that's drilled into your head. Car accident, go see my chiropractor. Car accident, Premier Care, All American Wellness Center. Let's talk about radiculopathy versus peripheral neuropathy. Number one, what are the differences between the two? All we have to do is go on Facebook and look at all the messages that come across on a daily basis, and they talk about peripheral neuropathy. What is that? That is any kind of symptoms of discomfort that one experiences in their hands or their feet. Pain, numbness, tingling, burning sensations, stabbing pains. And when people have this in their hands and feet, they certainly need to see a doctor about what is causing the problem. Remember, when you're getting treated for a problem, accurate diagnosis is critical to determine whether you're going to have successful treatment. And this is where we need to kind of figure out, what is this condition that I'm suffering with? I can only speak about what happens when people come into my office. So when you come into my office, you fill out two pieces of very important information that lead me to what may be causing your condition. Number one is all the information about you, how old you are, things of that nature that are more administrative. But the second piece of paper is critical. It's what I call a systems check. We look at all the systems in the body and you rate them as to how they're functioning. How are the eyes? How is your skin? Are you getting headaches? Are you having mood swings? Do you get any problems in your chest, palpitations or chest pain? Is your digestion good or is it poor? Are you having problems with elimination? Are you having problems with energy? Are you sleeping well? All of these questions that you answer help me as a doctor to zone in on the things I want to ask you and focus on a little bit more in depthly than you just rating it. When I was a younger physician and being taught by Dr. Goodhart, who was the founder of the International College of Applied Kinesiologists, which is a worldwide organization. There are thousands of applied kinesiologists throughout the world that are medical doctors, osteopaths, dentists, and chiropractors, and perform this specialty that gives us an advantage of great insight to helping a person when they're having certain problems. At any rate, after you do a thorough history on a patient, it will many times tell you what the problem is, and now your exam is just to reinforce what you're already thinking is the patient's problem. So when a patient comes to me and they're complaining of pain in their hands or pain in their feet, then we do a thorough history and a thorough examination. Let's give an example. If someone is having problems with pain and numbness and tingling and stabbing pains and burning in their feet, the first thing I look at, of course, is their feet. We look to see, is there any swelling? Do the toenails seem discolored? Is there adequate circulation when I feel the pulses? Is the person experiencing a hyperreaction when I touch the foot? Is the foot hot? Is it red? Is it swollen? Many, many indications of whether there's a localized problem in the foot itself have to be evaluated. And if those particular parts of the examination show up as not really what we call positive findings, and in those cases, positive findings means something's wrong. We next go into what are likelihoods to create this problem. And this is where it goes back to the history. When someone comes to see me and they're overweight, when someone comes to see me and tell me they have problems with their blood sugar, it's not quite diabetes. It's not 125 as far as the diagnosis in the glucose. It's maybe 110, 115. So their doctors have told them they have pre-diabetes. Well, one of the things I start suspecting is they may very well have peripheral neuropathy. Peripheral neuropathy is a condition that affects the nerves in the feet and in the hands as a result of vascular compromise. The very small blood vessels that bring oxygen to the tissues, to the tips of the fingers, to the toes, they're called arterioles. So you have the large blood vessels that bring oxygenated blood called arteries, but they get smaller and smaller, kind of like picturing a tree that has big, thick branches and gets smaller and smaller to the twigs. And those arterioles are very important for bringing oxygenated blood to the very tiny nerves that are located in our feet and our hands. And when there is a condition that makes those blood vessels become blocked or not provide rich oxygenated blood, it affects the nerves. And when the nerves become affected anywhere in the body, you're going to get pain. You're going to get numbness. You're going to get tingling. You're going to get sensitivity. You're going to get stabbing pains. You're going to find it hard to walk and hard to use your hands. And this is the crux of peripheral neuropathy. And it can be the canary in the cave. What do I mean by that? Little history. Years ago, let's go back into the 60s and 50s, we had a very large coal industry, and someone had to get the coal out of the mines. So we had miners that would go into these caves and take out the rich coal and bring it and utilize it for making a lot of products that we use to heat our heaters and provide energy. And this is before there was a lot of technology. So low tech, they would bring canaries in cages into the caves. And if the canaries died after they were in the cave for a while or dropped to the bottom of the cage, the miners knew there was something wrong with the oxygen content in the cave, and they rushed out so that they didn't have a life-threatening condition affecting them. And that's where the term canary in the cave came out. So in this case, the canary in the cave for people who have peripheral neuropathy means that you may have issues with your insulin metabolism. Before you get diabetes, you start having problems with your insulin, and this happens when you have large amounts of carbohydrate in your diet, and your body becomes insensitive to insulin, and it starts to cause vasoconstriction to those blood vessels. There's something that you can do about that, and you have to do about it quickly, and a lot has to do about therapeutics that are applied in doctors' offices. In our office, we use a series of different lasers, class 3 lasers, class 4 lasers. We use vibration therapy. We start evaluating the person's diet right away to help you prevent developing diabetes. Diabetes is a serious disease, and it's in abundance in our country, and it kills you slowly. It can give you a heart attack. It can give you a stroke. You can lose your toes, your fingers, your feet, your legs as a result of having diabetes. And it's because you're eating the wrong things over and over and over again. Hear me. There are things that you can do to prevent diabetes. And when you have peripheral neuropathy, it's your body telling you something is wrong. I need to make a change. And yes, you do. And the first thing you need to do is call your doctor and make an appointment. Speaking of which, we have a free 15-minute evaluation at our office. Any condition you have, we can let you know whether you have a functional issue that can be treated in our office, or you have the beginnings of disease and pathology and you need to see a medical doctor. We can even tell you which medical doctor you need to see. Back to the canary in the cave. When you have this kind of condition, it also may be creating problems elsewhere other than your feet and your hands. Maybe your heart. And today I'm going to give you a piece of information that makes it totally worth you spending some time with me. Right now, there is a company called Life Imaging located in Deerfield Beach, Florida. They've just received a ton of grant money from the government to provide vascular studies of the blood vessels in your heart. And quick quiz. Show of hands, though I can't see them. Let's just pretend. What do you think is the first sign for 50% of the population that develops cardiovascular disease? What do you think the first sign is? Chest pain, shortness of breath, arm pain, sudden death. What? You're crazy, Dr. Usry. I'm not crazy. I'm telling you, it's right from the front page of the American Heart Association's handout when you're about to take your first class in CPR. Pay attention, folks. Cardiovascular disease is everywhere. Have you been in a public building lately and saw one of those funny little boxes on the wall? It's called a defibrillator. They're there because people fall down dead with heart attacks all the time, and they don't have this heart attack where they're feeling chest pain or I'm uncomfortable. No, they fall over dead. You have 4 to 6 minutes to get to them to save their life. That's why CPR was pushed so heavily in the 60s by the American Heart Association and the American Red Cross. Being able to perform CPR, you can be a hero. You can help save someone's life. And if you know how to use one of those defibrillators, and it's so easy, if you can read directions during the time where this stressful event is going on, again, you can bounce that person's heart back to a normal rhythm if they're lucky enough to have had the type of arrhythmia that's given them a fatal heart event, but they are able to be resuscitated back to normal. That's what the defibrillator is for. That's what CPR was for. That's why you see paramedic trucks all over the road. They put us, and the reason I say us, I was a paramedic when I was 18 in 1974. That's why we were on the road, to help people who fell down suddenly with a heart event that gave them sudden death. So I kid you not, 50% of the people that develop heart disease will have a fatal heart attack. Get off the couch, pull your phone out, call Life Imaging. I don't get any money for telling you about them. I just want to help you save your life. As quickly as you can fill out 2 pages of information that they ask you to do, and you get on the gurney, before you even get completely comfortable on the gurney, they have you in and out of the scan and you're done. And they'll tell you exactly what's going on in your blood vessels, whether you have what they call atherosclerosis, or whether you have fat and particles in your blood that can give you blood vessels, that can give you a fatal heart attack. Do it. It's free. It just takes your time. All right, enough of that. Anyway, so we're talking about peripheral neuropathy. I told you the things that you could do to address that. Number one, you're going to have to do your part. You're going to have to change your diet radically. And we will start telling you the things that you need to help your body become more sensitive to insulin. Once again, insulin is a normal hormone that is produced by the body that helps, like a pickup truck, take the sugar into your cells so that your cells can use it. Incidentally, fun fact, your brain, most important organ in your body, needs constant glucose and oxygen in equal amounts all the time. When you're sleeping, yes. When you're on a date, yes. When you're watching television, yes. Every time, yes. So let us help you. Give us a call if you think you have peripheral neuropathy. And many times if you're a smoker, well, the first thing I'll tell you before you even make an appointment, stop smoking. If you've got problems with diabetes and you're getting these symptoms, quit sticking sugar in your mouth. Now, that's something you can do right away and be proactive, so when you come and the doctor says, well, what's your diet like? You can say, I've cleaned up my diet, doc. I'm on the way to get myself healthy. There you go. Everything you need to know about peripheral neuropathy. It can be reversed. It can be helped. You don't have to have surgery. You don't have to go on medication. And believe me, the medication that medicine offers now is something called gabapentin. It doesn't work well. So don't even bother going down that road and getting on more medicine and dealing with more side effects from medicine. Just come in. We'll tell you the things that you can do. Or look at some of the other places that are advertising on Facebook. There are a number of different clinics that offer the same kind of approach. Light therapy through laser, vibration therapy, different types of technological machines that can help those areas that are being affected with vasoconstriction to once again dilate and provide the necessary blood that you need. What is radiculopathy? Well, radiculopathy and peripheral neuropathy appear to the patient very similarly. The same thing. Those sensory nerves become affected. Pain, numbness, tingling, throbbing, sharp pains, burning sensation. All of that can happen with peripheral neuropathy and radiculopathy. Well, what is the difference? Big difference. Radiculopathy is a neurological condition that comes from mechanical pressure being put on the nerves. Peripheral neuropathy occurs from a vascular issue being affected from biochemical reasons, and we just talked about those. When you have radiculopathy, it tells another doctor, oh, they're having a problem right where the central nervous system in the spine exits and turns into the peripheral nervous system. So peripheral, it's a funny word. We've heard it. What does it mean? It means that which is not in the central area. So your central nervous system is your spinal cord, right? Protected by those 33 bones in your spine. And when you have vertebral subluxation, what is vertebral subluxation? We've already talked about it, but you have 33 bones in your spine, one stacked over the other, 33 times to form your low back, your mid back, and your neck. And in between those two bones in your spine, you have a disc. Well, if you can't picture it, picture an Oreo cookie. Don't eat it. Okay? Picture an Oreo cookie. Pretend that the chocolate part on the top and the bottom are your vertebrae or the bones in your spine. And that vanilla cream in the middle is like your disc. Now, when you unscrew it and eat the cookie, imagine instead of doing that, you're pushing the cookie together. What do you think happens to that vanilla icing? Well, it squirts out all over, right? And when we have certain injuries, that vanilla icing, like your disc, can put pressure on the nerve and cause anything from pain in your back, pain in your butt, pain down your leg, and pain in your feet. But what's the big difference when you have radiculopathy? Right away, I just explained to you neuritis, but what's the difference? Well, when we test certain functions in your motor system, in addition to sensory nerves, you have motor nerves. The way your brain tells your big toe to lift itself up when you're walking, something you don't even think about. But every time you walk, if your big toe and your other four toes are not lifting up when you walk, well, you trip and fall. Matter of fact, if you have diabetes and you haven't been smart enough to control your diet and do something about it, when they eventually have to amputate your big toe, okay, you're going to have to learn how to walk all over again. 40% of your function comes from being able to lift your toe, your big toe primarily, and the other four toes that go along with it for you to walk properly. So when we check to see how those muscles are functioning, what we end up finding is those muscles aren't functioning normally. And then when we take and look at the muscles that help support your foot, we find those are not functioning normally either. That's radiculopathy. And how do we treat that? With decompression. So all of these things that you've heard about decompression, that is for radiculopathy. So when someone comes into my office, we take an x-ray to look at the disc space, or they come in with their MRI so we can see if there's been damage to the disc, and we start them on things that are necessary to get that problem taken care of. So there you go. There's a difference between radiculopathy and peripheral neuropathy. Either condition can be treated in our office at All American Wellness, and successful treatment comes with accurate diagnosis. So you have to make sure that you go to the doctor who's had the training and experience, such as myself, 40 years of training and experience. You're going to find a premier physician at All American Wellness, if I do say so myself, and we are very good at what we do, and we can help you. And I can tell you in a short period of time, 15 minutes, doesn't cost you any money. All it costs is your time. So give us a call at 561-863-8779. Make an appointment. I'm ready to wrap up now, and I'm very thankful to Podcast Junkies, that's podcastjunkies.com, who have given me this ability to speak to you out there on Spotify, Apple, and YouTube. So look for us. We're there every week, once a week. I always enjoy speaking about things that affect your health. Here's a little memory test. What was the first thing I talked about? You got 2 weeks to get into your doctor after you have an automobile trauma. Don't think it's nothing. Don't make light of it. It's been a major trauma that happened quicker than you can blink your eyes, and your brain hasn't completely processed it yet. But if you think you haven't been injured, you're wrong. And if I'm wrong, prove me wrong by going and have that examination and x-ray, and then call me and say, hey, Dr. Usry, you were wrong. Okay, I don't mind being wrong as long as you're on the right side of being safe and careful. So thank you for joining us at All About Health and Wellness. Thank you, Podcast Junkies. Thank you, All American Wellness. And I look forward to seeing you next week. So goodbye for now, and thank you for joining me.